All right, welcome back, ladies and gentlemen. And a group that always love visiting with is the National Center for Public Policy Research. They do great work in all kind of different areas, and they've got one of their projects that we want to highlight right now. It's called Able Americans, and the senior researcher for that organization is with us now. This is a group helping Americans living with intellectual, developmental, and physical disabilities. Dr. Mark Mostert is with us. And Mark, how are you, sir? Welcome.
I'm very well. Thanks for having me, Jeff. I appreciate it.
Yeah, thanks for being with us. So you wrote a piece that was just in the American Thinker titled "The Social Security Disability Nightmare." Tell us more, Mark.
Well, what you have to know is that the Department of Health and Human Services is a massive bloated bureaucracy, as most things are in the federal government. And their intent, of course, is to spend money to help and support people with disabilities across the United States. They do that in a not very efficient or effective way. The total bill in Health and Human Services expenditure depends on the year, but runs somewhere in the region of $4.5 trillion. That's a lot of money. But what's even more shocking is that the amount of money that is wasted through fraud, incorrect coding and so on is astronomical. We're talking, it depends on what figures you use, it's hard to tell sometimes, but roughly between $100 and $150 billion a year is wasted. Now that's a lot of money that could be going to help out veterans with disabilities, communities where people with disabilities live, the services they're provided. All of that money goes to waste. And here's another part of the problem that I think is quite alarming. Health and Human Services and the federal government have programs to recover some of that money. They don't recover very much. Again, the numbers are squishy, but approximately somewhere in the $2 billion a year, which is a real drop in the bucket. However, that money that's recovered, however much it is not cycled back into helping people with disabilities. It's sent to the programs that help recover the fraud, to defend lawsuits and so on. So even the recovered money is not going back where it should be. And the other problem is, amongst all this rampant fraud and waste, trying to access services, if you're someone with a disability or if you have a loved one with a disability, is a nightmare to get through. You have to navigate multiple agencies, multiple people in each agency, and so on.
Now, Mark, people that I know that have disabilities tell me it's very hard to get approved for these payments. And they say they've been trying for a long time and they keep getting rejected. Is the process too convoluted? Does it need to be streamlined?
Oh, there's no doubt about that. Absolutely, it needs to be streamlined. The difficult part is, how do you streamline a bureaucracy that's so bloated? The left hand has no idea what the right hand's doing. Multiple layers of turf wars, et cetera, et cetera. It's almost impossible to think of this getting streamlined. And as I've dug deeper into this, the more I despair that we're not going to be able to do that.
So how can we do this? But we're always going to, I mean, is there any way to take it away from the government, where we can privatize this somehow or make it more efficient? Because, you know, a government bureaucracy is never going to be efficient. There's always going to be waste, fraud, and abuse.
Right, that's exactly right. Now, of course, trying to wrest anything from a government entity into the private sector is a challenge in and of itself. But we at Able Americans really think that the private initiative, private entrepreneurship is likely to drive those kinds of fraudulent costs down and provide more effective, more efficient services. And you're absolutely right. When people with disabilities have to apply to the federal government, whatever the agency happens to be, for their disability support, it's a nightmare. You never get the same person twice on the phone. If you check one wrong box, they reject the entire application. Of course, there are waiting lists forever and ever. So all of this means that people with disabilities are not getting effective, efficient, or immediate help.
It's a tragedy. Now, in your column, you talk about many of these policies and programs haven't had major updates. Get this, folks, in 40 years? 40 years?
Yeah,
how can that be, Mark?
Well, this program that I mentioned is a program that designates and defines what jobs there are for people with disabilities, potentially, right? And this is, it hasn't been updated for 40 years. And in the one that they have that has not been updated, they have jobs like elevator operator. Okay, well, No one does that anymore, but that was 40 years ago, and we haven't moved the federal government into 2024 for jobs, maybe some exciting, that people with disabilities could do. And trying to get that updated has been such a nightmare that basically the government's just given up. So again, how does that
What
help
about
people?
Congress? I mean, isn't Congress responsible for oversight of this? I mean, doesn't Congress fund these programs? I mean, don't you have congressional committees that are supposed to be looking into these issues? Is that going on, Mark?
It does. I think Congress, at least many in Congress, are aware of the waste, the fraud, and abuse. But again, as we know from other government agencies at the federal level, when you try to get answers to anything, you run into stonewalling, you run into vagueness, you run into no one's ever responsible for anything. So that's why people in the disability community really despair of anything ever changing for them. And I think in this country, where we provide so much money to other causes needlessly, in my opinion, we could certainly focus on our citizens that need it with disabilities. But that's not happening. And at Able Americans, we're going to try and change that. We're putting forward policy suggestions to people on the Hill. We hope they'll take those up, turn that into law eventually, and get some relief for these folks.
In our final minute or so, leave us with one free market solution you think would work to at least help move us in the right direction, Mark.
Well, there are plenty, obviously, but I think there's basic stuff that needs to be done. One is that streamlining of the identification process for people who apply. The other thing is the amounts of money in Social Security and so on, and also around Medicare, Medicaid, have not been updated for inflation in years and years and years. So if you're an individual who finally qualifies after this nightmare of paperwork, basically you qualify for a maximum of a little over $2,000 a month. That's it. That's a drop in the bucket in this day and age. That's one thing that could be changed immediately. If they simply updated and adjusted for inflation what those payments should be, that would provide some relief in the short term for sure.
All right, Mark, thank you for your work. Thank you for your organization and highlighting these important issues, and we appreciate it very much. Dr. Mark Mostert with us of Able Americans.